Okay, it's Dr. Wolfe here for part 8. This is the supplementary report that comes in after the original report. So, in other words, this came in a little while later and involves the examination of the brain and the microscopic examination. So, basically, it's called Gross Description of the Brain. Now, what happened is at the time of autopsy, and this happens when you need to closely examine a brain, you don't just look at it at autopsy and then move on. Now, if it's an obvious case, somebody dies of a heart attack, you know they've died of a heart attack, you can look at the brain at that time and move on with it. But in this case, the most of the pathology was for the brain because of the gunshot wound. So what happens is you remove the brain and you put it into a formaldehyde solution called formalin. So it's like dilute formaldehyde for a few weeks. We usually do 2 to 4 weeks, but in this case it was much sooner. You could probably get away with a week of formalin fixation. But, you know, in this case, I think they were looking to just close the case so that they didn't wait too long, it appears. Following formalin fixation, the brain weighs 1,500 grams. So my first thought here is that the brain, if you were to ask me what the average brain size was for any human being that's an adult, it would be somewhere between 1,200 and maybe 1,500, 1,600. So the interesting part here is that a large portion of the brain was actually gone because of the gunshot wound exploding it out of the side of the head. And yet what remained still weighed 1,500 grams. So a little bit of an enlarged brain, although it's within normal limits. The right cerebral hemisphere is found to be markedly disrupted. So that's a way to describe, when you say markedly disrupted, I use that exact term, and I've never even seen this report before I read it. It basically just means it looks really ugly. There's not a well-defined injury. It's just, you know, completely blown out, basically. There is a longitudinal laceration of the right hemisphere, which is parasagittal in position, approximately 2.5 centimeters to the right of the midline, which extends from the tip of the occipital lobe posteriorly to the tip of the frontal lobe anteriorly. So that's a lot of words all at once. Basically what it's saying is he's referring to that disruption as a laceration. And it goes 2.5 or about an inch to the right of the midline, and it goes from the very back of the brain, the occipital lobe, to the frontal lobe, okay? That's what he's describing there. I am going to show you a figure that kind of demonstrates that. This is a view from the top of the brain showing the bullet entering the occipital lobe, passing through, and exiting through the right frontal lobe. Now, to continue on this description, the base of the laceration is situated approximately 4.5 centimeters below the vertex in the white matter. So the vertex meaning the very top of the scalp, and 4.5 centimeters is going to be about that much. So, you know, it's a couple of inches basically below the vertex. That's where the base of the injury is. There is considerable loss of cortical substance above the base of the laceration, particularly in the parietal lobe. That is medical speak for the brain tissue was blown out. The margins of this laceration are at all points jagged and irregular, with additional lacerations extending in varying directions and for varying distances from the main laceration. Again, gunshot wounds to the brain are there's not really a good form. Like when you see a gunshot wound to the arm or to the chest, it's very well formed. It's very easy to measure, usually circular to oval. But when you have something very soft like brain tissue, it just explodes it out, and it's very irregular. So that's what they're basically describing there. In addition, there is a laceration of the corpus callosum extending from the genu to the tail. Exposed in this latter laceration are the interiors of the right lateral and third ventricles. So without going deeply into neuroanatomy, and I may do that at some point, but today this just means the center deep portion of the brain, okay? Again, we will view a video rather an image with my voice overlaid to kind of point out where we are. So this is the brain viewed from the right side to show the bullet passing through the occipital lobe, the middle part of the brain, and out the frontal lobe. From the vertex or top of the brain to that red arrow is 4.5 centimeters. When viewed from the vertex or the top of the skull, the left cerebral hemisphere is intact, which we would expect because it did not get hit by gunfire. There is marked engorgement of the meningeal blood vessels of the left temporal and frontal regions with considerable associated subarachnoid hemorrhage. So anytime you have a massive injury to the brain, whether it's a gunshot injury or it is a blunt force injury, let's say from motor vehicle trauma, you will get subarachnoid hemorrhage even in the area where it didn't get hit. So that's pretty common. The gyri and sulci over the left hemisphere are of essentially normal size and distribution. That basically refers to the undulations, the surfaces of the brain, kind of how it has that squiggly appearance, for lack of a better term. Again, these videos are not for medical experts. These videos are for people with no medical background. So that's the best way I can describe it. Those on the right are too fragmented and distorted for satisfactory description. Again, this area was blown out. When viewed from the basilar aspect, that means the bottom underneath the brain, the disruption of the right cortex is again obvious. There is a longitudinal laceration of the midbrain through the floor of the third ventricle, just behind the optic chiasm and the mammillary bodies. So we're going to look at a video of this. The areas in red that are surrounded by yellow represent the lacerations at the base of the brain, one at the cerebral peduncle and multiple at the base of the frontal and temporal lobes. So this laceration partially communicates with an oblique 1.5 centimeter tear through the left cerebral peduncle. There are irregular superficial lacerations over the basilar aspects of the left temporal and frontal lobes. So why are there injuries to the left side on the temporal and frontal portions? Well, it's because the skull base, the brain sits in the skull base, and very often when you have a high velocity round go through, or even a motor vehicle accident type injury, you will very often have the skull fractures of the base of the skull. And those little pieces of bone can actually injure and lacerate the bottom of the brain. This is the basilar view of the brain, meaning we are underneath the brain and looking up. Now, on the left side of your screen, that's actually the right cerebral hemisphere, because remember, we're looking from the bottom up. And this represents the gunshot wound to the head that passed through the occipital lobe, the middle part of the brain, and out the frontal lobe. So now this is more just kind of academic speak. In the interest of preserving specimen, coronal sections are not made. The following sections are taken for microscopic examination. First, let me explain what is meant there. Coronal sections, again, are in this plane here, okay? It's like this, so cutting slices this way. Now, when we examine a brain, 99.99% of the time, we do take those coronal sections, also known as, in layman's terms, bread loafing, because it's like cutting a loaf of bread. In this case, he said he wanted to preserve the brain. He did not want to make those slices. Why was this done? It's very likely that this is just, it's the fact that it's a historical figure. It's the President of the United States. Do we really want to chop his brain up for something that is going to provide almost no additional information to the case in terms of cause of death or manner of death? So I think they wanted to keep that brain intact just for posterity's sake. Now, the interesting part is I couldn't find information on where that brain is. I'm looking a little more into this, but it sounds like the brain was lost or stolen or who knows what. That's for another day. So here are the sections that they took from the brain. From the margin of the laceration in the right parietal lobe, from the margin of the laceration in the corpus callosum, remember that center deep part of the brain, from the anterior or front portion of the laceration in the right frontal lobe, from the contused left frontoparietal cortex, so that's going to be over here, from the line of transection of the spinal cord. So what that means is when you take a brain out, at the very bottom, it is still attached to the spinal cord. And you have to take a scalpel. I usually like to use a long handle scalpel. This is an Apple pencil. It's not a scalpel. And I go into the foramen magnum, which is the hole at the base of the skull, and make a little semicircular cut. He's basically saying he's taking a section of that spinal cord. From the right cerebellar cortex, the cerebellum is the very back part underneath the main cerebral hemispheres, and it is a structure that is it has a lot of functions, but a lot of it is to do with balance and things like that. So I took a section there. And from the superficial laceration of the basilar aspect of the left temporal lobe. So in other words, we're under the brain and we're on the temporal side, which is going to be down here. And there's a laceration there. And so they take these sections because taking them at the margin is a very common thing for pathologists to do. And it also makes sense because you might be able to see fragments of bullet microscopically or fragments of metal or soot or something like that. So in this case, that's what they took. And then it says, during the course of this examination, 7 black and white and 6 color 4x5-inch negatives are exposed but not developed. The cassettes containing these negatives have been delivered by hand to the Rear Admiral George W. Berkeley, MC, USN, White House physician. So, in other words, they took photos of this brain exam. I have never seen those photos. To my knowledge, they are not public. They would be very interesting to see, but they're just not made public. And it's probably because it's considered to be kind of a gruesome thing. The fact that this is the presidential brain and they're examining it, a couple of weeks or whatever after he had been killed in autopsy. All right, and for the sake of completion, we are going to go through the microscopic examination. When we do an autopsy, we can take small pieces of organs and tissue, usually smaller than the size of a postage stamp, and we submit those for processing, and then they are given to us on microscopic or glass slides for microscopic examination. We look in the microscope in order to find things that we can only see and diagnose with the microscope that we cannot see with the naked eye. Many cases don't really have any findings, and some cases the microscopic examination seals the diagnosis. Now, in this case, it was just a formality that they did this. Brain. Multiple sections are represented from representative areas as noted above, are examined. All sections are essentially similar and show extensive disruption of brain tissue with associated hemorrhage, which you would expect with a gunshot wound. In none of the sections examined are there significant abnormalities other than those directly related to recent trauma. In other words, the brain tissue did not have any pathology, any organic brain disease, things you can see like Alzheimer's or Parkinson's. The brain tissue was normal. Heart. Sections show a moderate amount of subepicardial fat. The coronary arteries, myocardial fibers, and endocardium are unremarkable. So first of all, that first sentence says moderate amount of subepicardial fat. That is a normal finding. Our hearts are not bright red and just perfectly smooth. They are invested in fat. It's a form of connective tissue that protects the heart. So when we see fat on the outside of the heart, it doesn't really mean anything. And then the rest of his heart exam was completely normal. So John F. Kennedy had a perfectly normal heart, 46-year-old male, and you would be hard-pressed to find a 46-year-old male today that has a heart like this. Lungs. Sections through the grossly described area of contusion in the right upper lobe exhibit disruption of alveolar walls and recent hemorrhage into alveoli. Sections are otherwise essentially unremarkable. So in other words, this is normal lung tissue, but there's some bleeding into the air sacs as a result of that shock wave from the bullet that just passed the lung. Liver. Sections show the normal hepatic architecture to be well preserved. The parenchymal cells exhibit markedly granular cytoplasm, indicating high glycogen content, which is characteristic of the liver biopsy pattern of sudden death. Now, that's pretty interesting because here I am 60 years later. I trained in pathology from 2004 to 2008. So my training is recent. I have never in my life heard the phrase liver biopsy pattern of sudden death. But suffice it to say, this is not an indication of pathology of his liver. The spleen. Sections show no significant abnormalities. To be honest, it's not very common that we actually find pathology in the spleen on autopsy sections. Kidneys. Sections show no significant abnormalities aside from dilatation and engorgement of blood vessels of all calibers. So that's a normal finding. These are normal kidneys. The only part here that kind of upsets me a little bit is that John F. Kennedy was known to have a disease called Addison's disease, which is an autoimmune disease of the adrenal glands, okay? And according to this, his adrenal glands were not sampled. So that bothers me a little bit. You should sample the adrenal gland with the kidney on both sides for every autopsy that you're going to submit sections on. So it would have been interesting to see if his adrenal gland showed any pathology due to this Addison's disease. Skin wounds. Sections through the wounds in the occipital and upper right posterior thoracic regions are essentially similar. In each, there is loss of continuity of the epidermis with coagulation necrosis of the tissues at the wound margins. The scalp wound exhibits several small fragments of bone at its margins in the subcutaneous tissue. So we take sections sometimes of gunshot wounds because it can give us a few clues about how far that gun was away. Now, in this case, we know that the rifle was fired from far away, and therefore there's not going to be any gunpowder or soot or anything like that. If a gun was fired close, you might actually be able to see soot in the microscopic sections of this. So this is a way to basically prove that the gun wasn't close. And then final summary. This supplementary report covers in more detail the extensive degree of cerebral trauma in this case, so brain trauma due to gunshot wound. However, neither this portion of the examination nor the microscopic examinations alter the previously submitted report or add significant details to the cause of death. In other words, it was case closed the day of the autopsy. It was a gunshot wound of the head and a gunshot wound of the back, and nothing in these additional tests changed that. And then some people who listen to these type of things, they will be contrarians and say, well, then why did we do it anyway? Well, because you can't know unless you do it. So you have to look at the brain. Maybe there's some brain pathology that could be helpful. You might see fragments of metal from the bullet itself, which is important to folks in the ballistics departments. Or soot, gunpowder, things like that. This examination essentially proves that there was no gun that was close, which is consistent with what is seen with the Zapruder film and with the scene examination itself. So that's why you do those additional tests. Microscopic examination, it's just a matter of habit for these cases. I mean, some offices do it on every single case, no matter how obvious the cause of death. It could be a piano falls onto a guy and kills him. They're still going to take sections. So it was the way that they did it in this particular lab. So that is the conclusion of the autopsy report itself. I am going to do one more video, and I'm basically going to do my summary of their report and things that I think may have been done correct or incorrect, and then ultimately my opinion based on the evidence that I've seen. So thanks again for listening.